to know why, as a woman, I need to fear losing reproductive health benefits. Gentlemen, have you ever walked into a doctor's office and feared being denied any care? I want to know why, as a woman, I need to have those fears. Good morning, my name is Janelly B. Social media and even government officials have come up with this fallacious idea that Planned Parenthood is strictly an abortion center. However, it's not about abortion. It's about health reinforcement. Leila Abu-Luqad, Muslim and woman activist, has stated, when you save someone, you are saving them from something. You are also saving them to something. Government officials must begin to question if the country should be more worried about saving the future of money in healthcare or preserving health services that allow citizens to exercise their freedom of choice. For this reason, it is time that the country begin to recognize the services provided by Planned Parenthood that extend farther than its practice of abortion. Such awareness can at length save federal funding of Planned Parenthood and overall women's health. Planned Parenthood can be traced back to the year 1916, where Margaret Sanger took pride in the idea that women should be able to make decisions with their own bodies. Sanger was sure to let the world know that Planned Parenthood was founded on the idea that women should have the care they need to live healthy lives and fulfill their dreams. About 50 years went by, and with hundreds of women banding together to fight for abortion rights, states began to legalize this practice. The 1973 Roe v. Wade court case ended with the Supreme Court decision that recognized that the constitutional right to privacy extends to a woman's right to be able to make her own medical decisions, even the decision to have an abortion. By the end of the 1970s, the first Planned Parenthood clinic to practice abortions was opened in New York City. As a result of beginning to practice termination, many began to argue that the government should not sponsor a facility who encourages or glorifies the practice of abortion. For example, Republican Senator Dan Coates has stated, the barbaric practice of conducting abortions in a way that promotes harvesting fetal organs or profiting from such practice has no place in a modern society. However, defunding Planned Parenthood only puts an immense amount of limitations on women's overall access to health care. Miriam Berg, spokesperson for the Planned Parenthood Action Fund, has stated that federal funding comes through Planned Parenthood via reimbursements for the services that they provide. Here's an example of how federal tax dollars support Planned Parenthood patients. Casey has Medicaid coverage and comes to her local Planned Parenthood Health Center for preventative care. She goes on to get birth control, an STD test, pap smear, or any other care needed, likely at no cost. Planned Parenthood would then submit a claim to Medicaid. Medicaid would then reimburse Planned Parenthood for their services, and the state Medicaid agency would then send a bill to the federal government. Finally, the federal government would reimburse the state where the Planned Parenthood services were provided. Berg has went on to reveal that 60% of Planned Parenthood's patients rely on public health care programs such as Medicaid and Title X, while the remaining 40% rely on other independent health insurance providers. Clearly, defunding Planned Parenthood puts a large amount of its low-income patients at risk for receiving limitations on their access to health care. In addition to services for women, Planned Parenthood is also providing health services to men. On numerous occasions, the corporation has revealed that it provides 5 million men, women, and adolescents annually worldwide with preventative care. It is time that this corporation be viewed as more than an abortion center. It is time that the government see how much more Planned Parenthood contributes to society and overall health care than just abortions. In fact, Abby Borovitz, an accredited social and political activist, has stated that abortions only account for 3% of Planned Parenthood's overall services. Ashley Strickland, a well-known health and wellness writer, has went on to reveal and support this claim. Strickland has went on to reveal that in 2014, Planned Parenthood conducted 1.1 million pregnancy tests, 360,000 breast exams, and 270,000 cervical cancer screenings. In the same year, you can see that abortion still only accounted for 3% of Planned Parenthood services. When it comes to the future of Planned Parenthood, nothing is for certain. As time has gone by, we have seen an increase in pro-choice supporters than pro-life activists. Pro-choice activists embrace the idea of everyone being able to make decisions with their own bodies, whereas pro-life activists are completely against the idea of abortions. Republican Senator Dan Coates, who I previously mentioned, would be an example of a pro-life activist. Don Legmans, Executive Vice President of Planned Parenthood, has discussed a poll that revealed 41 to 54% of Americans identify themselves as pro-choice, with only 38% to 50% identifying themselves as pro-life. Clearly, we are seeing an exponential growth in those who support the idea of freedom of choice when it comes to one's decision with their bodies. Cecile Richards, president of Planned Parenthood, has revealed that millennials are the future of this corporation because they desperately want to be involved and understand the need to be a pro-choice activist in today's modern society. Millennials are the future of reproductive health services simply with the impact they will have with just their votes. In fact, informing the public on the services provided by Planned Parenthood that extend farther than its practice of abortion can encourage federal funding. In addition, such awareness can save millions of patients from being denied access to the health service provider. Of course, other solutions, such as Planned Parenthood being federally funded by other independent sponsors or completely ending the practice of abortion at Planned Parenthood centers, can also encourage federal funding of the corporation. However, unlike these two solutions, awareness is the first step towards shifting those against Planned Parenthood towards supporting the organization. Arguably, awareness does not mean that the topic of defunding Planned Parenthood will completely go away and ultimately leaves it up for debate, because it is up to those in office and what they see best suits modern society. However, events such as the Women's March and Planned Parenthood rallies have taken place all over the streets of Washington, D.C., nationwide and worldwide, to rally for women's rights and overall health services. As Don Lagwins has went on to state, we can connect with as many people as possible by using language that doesn't turn people away, but instead reaffirms their support for abortion and healthcare access. In recent years, Planned Parenthood has been seen as more of an abortion center than an overall women's healthcare facility. For this reason, it is time that social outlets begin to provide awareness for all of the services provided by Planned Parenthood that extend farther than its practice of abortion, such as cervical cancer screenings, and even family counseling for those who are having at-home difficulties. As more and more people begin to band together and fight for freedom of choice and the overall rights of a woman, the force of the people cannot be stopped. Ladies and gentlemen, it is our body and our choice. Thank you.
Two questions for you. Can you tell me how your research question evolved as you went through this process?
Okay, so in the beginning, my research question was really just about how Planned Parenthood is viewed as more of an abortion center, and I didn't really want to talk about the federal funding of the whole side of it because I knew that I would have to go into the whole political, like Republic versus Democratic point of view. But instead, I kind of just turned it around and included the federal funding and included the Republican side of view as like my counter argument, and then rebutted it with my entire presentation talking about how federal funding is just so important for women's health care.
All right. And if you had more time, I'm sorry, I take that back. What advice would you have for others that want to research this topic?
I would say that you should go in and see just how much more they contribute to Planned Parenthood. I only talked about 3 other services that they provide, but they provide so many other services, such as, like, as I said, family counseling, and they even allow like LGBTQ people to go through their transformations through their corporation. So looking more into that and how many of those group of people go into that facility would be a great way to like further your point.
Thank you.
Thank you.